Okay, so you were an RN,
Yeah.
registered nurse. So why do you want to be a CRA now?
I am ready for CRA because I have a registered registered nurse license, and I have a bachelor degree of nurse science, and then I have a good excellent I can communicate well in English. So that's why and I have a clinical experience. From that experience, I realized that I want I want to use my abilities for to invent new innovate medicine for suffering patient. So that's why I want to be a CRA.
Okay, so when you're a nurse, you're working directly with your patients, right?
Yeah.
And this is more like you're going into research, right?
Yes.
So will you be working as much closely with patients still?
No.
Right. So why
But we have to focus our research. We also have to do with the trial test with patients. So we have to check with the side effect, patient side effect, and the patient health problem. So that's why you have to do more than hospital work.
So I guess it's more intensive.
Yeah, more intensive.
And you want something more challenging.
Yeah.
Okay. Great. And so how do you plan then to make the change? So you told me you have your licensed nurse, your registered nurse. So how do you plan like the strategy, like the steps? How are you going to right now you're a nurse, okay? How are you going to become a clinical research assistant?
I will keep learning about I have already knowledge of my nursing process and medical term and the disease, but I am not a pharmacist, so that's why sometimes I need to study about chemistry. But I will keep developing myself to study by studying.
So do you need to take a course, like a pharmaceutical course?
No, not, but I will take a training and then educating.
And how long does that take approximately?
Maybe 2 months.
Oh. Okay. So that's your plan to go back to Korea and then do this training for about 2 months, and then get the, I guess, certificate.
No, there is no certificate. I already have a requirement.
So it's just an additional training. That's really all you need to do?
Actually, if I have a clinical experience in an English skill and nurse license and bachelor degree, I don't need. But if I have a clinical research CRC experience, it will be more preference.
Oh, I see. They prefer that. Yeah. Okay. And so the transition then is easy, relatively easy.
Yeah.
Is there like a final examination you have to take?
No, I don't have.
Just the training.
Yes, training.
And then you would have to apply.
Yeah. And then if I have CRA experience, the CRC experience is more easy to get a job.
What CRC?
For nursing, especially for nurse, to be a clinical research kind of associate, but it's a little bit different.
Okay.
It's more specialized for nurse.
And what does the last C stand for?
Last C?
CRC?
I don't know about that.
Okay.
Yeah.
Right. Okay, so I'm going to ask you just one more question. What do you think that you have that you possess that inside of you that would make you our ideal hiring candidate?
Ideal hiring.
In other words, there are other people competing for this job.
Well, yeah.
Why should we hire you? What makes you stand out? everyone else?
I think I have an excellent knowledge of nursing process and medical term and disease, and I can communicate well in English, and I had a work experience, clinical experience, and I have an passion to work with your company. I really want to help for suffering patients, so I want to invent a new innovative medicine.
Okay. Great. Thank you.